Hello, my name is Joe Murray. I'm a gastroenterologist at the Mayo Clinic. Just recently, the FDA has finalized and put into effect the rule on gluten-free labeling. Now, this rule has been a long time coming. It's been almost 10 years ago that the Congress first passed the law that legislated as to allergens in foods and food labeling. However, as part of that law, they also required the FDA to formulate regulations to define what a gluten-free label means. Up until this, there really was nothing that defined a gluten-free label in the United States. And what the FDA has done is a careful study over several years. They've analyzed all of the known literature about gluten and its effect in patients with celiac disease to come up with an estimation of what is a safe threshold below which food is not likely to cause a problem in patients with celiac disease. Now, to do this, they undertook what's called a toxicological study, where they basically look at, well, what do we know about celiac disease? How much gluten does it take to trigger a response? And then go down about 10-fold less than that to provide a margin of error, let's say a margin of safety, to protect patients. They came up with a level of 20 parts per million. Now, to put this into perspective, 20 parts per million is a very tiny amount. And also, it's at a level where it's possible to detect gluten. There's not much point in putting a regulation in place without actually having a way of measuring it and being able to detect it. So what does this mean to patients with celiac disease? Well, this means that if a food is labeled gluten-free, it has to contain less than 20 parts per million. And for the great majority of patients with celiac disease, that food should not represent a problem. Now, of course, this labeling is voluntary, meaning a company doesn't have to put a gluten-free label on their food if they don't want to, and many will choose not to. But if they choose to put a gluten-free label on their food, then they will have to meet that standard. Now, how will this be enforced? Well, largely it'll be enforced through public complaint. If the public have a problem with a food, they suspect it contains more than 20 parts per million, they can complain to the FDA to seek enforcement. There are now test kits that can be used to test foods for gluten. So it'll largely depend on the honesty and the ability of food manufacturers to properly ascertain that the ingredients they put into their food are gluten-free, and also in many cases to actually measure their food and test it to make sure that it's less than 20 parts per million. So in general, good news for patients with celiac disease, setting standards that will increase safety for patients overall. Thank you.